Hi everyone. Today this video will be covering the treatment aspects of gallbladder stone. So what is the treatment for gallbladder stone? I would like to divide it into two type of gallbladder stone. One which is asymptomatic and the second one which is symptomatic. Asymptomatic gallbladder stone is when the gallbladder stone gets detected on an ultrasound, let's say in a routine health checkup, and the patient has not yet become symptomatic because of the gallbladder stones. So such patients who have no pain and are still detected with gallbladder stones are called as asymptomatic gallbladder stones. The treatment in asymptomatic gallbladder stones are mainly medical treatment, surgical treatment, or observation. So you have three options when it comes to an incidentally detected gallbladder stone which is asymptomatic. When it comes to medical treatment, it is not very popular, but there is a tablet called as ursodeoxycholic acid which can be given in patients who have gallbladder stones and who are yet to become symptomatic. The efficacy of this drug and the overall chances of these stones getting dissolved by this drug is rare. More often than not, it does not. So the medical treatment is the least effective and is the least popular treatment when it comes to asymptomatic gallbladder stones. So observation practically means that we are not intervening, we are not doing anything, and we are just waiting for the stones to become symptomatic and the patient to develop pain, and then we act accordingly. Symptomatic gallstones are always treated by surgery. So very commonly patients ask for medical treatment for symptomatic gallstones. There is absolutely no role for medical treatment in a person who has developed pain and he's diagnosed to have gallbladder stones. The medical treatment with ursodeoxycholic acid is only a part of asymptomatic gallbladder stones, and in them also we really don't know how much of it is going to be useful. So when it comes to a symptomatic painful gallbladder stones, it is very clear that the treatment is always going to be surgical. Now the surgery that is done is called as laparoscopic cholecystectomy. Laparoscopic is to do the surgery in small holes, that is about 5 millimeter to a centimeter each, and ideally we utilize 4 holes in laparoscopic cholecystectomy. Cholecystectomy means taking out the gallbladder. So laparoscopically we are taking out the gallbladder and of course the stones which are present within the gallbladder, and this is the exact treatment of a painful gallbladder stones. Now I will discuss the most commonly asked questions by my patients. Number 1, what is the recovery time? The surgery, admission and pre-operative, post-operative management most often needs about 24 hours to 36 hours of admission. So the patient can go home the very next day of surgery. Can the stone be removed and the gallbladder left behind? This is a very common question that is asked by my patients, that doctor, please just remove the stone. Why do you want to remove the entire gallbladder? To understand this, we should understand why the gallbladder stones happen in the first place. The stones happen because of a defective gallbladder. So unless we remove the gallbladder, we are unable to treat the gallbladder stone. Removing only the stone and leaving behind the gallbladder increases the person's chance of developing more gallbladder stones, and very soon he is going to come back with multiple gallstones, and we go into a never-ending cycle. So unless we remove the gallbladder, the treatment cannot be done. Does the removal of gallbladder cause any long-term effects? So the answer to this is no. Gallbladder removal is extremely safe and it does not lead to any long-term serious complications. Very few percentage of people do develop some mild indigestion, sometimes excessive flatulence and an occasional diarrhea. These are also very easily treated with medicines, and it is extremely safe to get the gallbladder removed without developing any long-term side effects. When can I resume my job? So I have had patients who had to fly out of India as soon as possible after surgery, and they have in the very next day. One of my patients went 2 days later abroad. So there's really no cutoff as to when can you resume your job. As soon as you start feeling better, you can. It may be a couple of days to a week maximum, not more than that. When can I resume exercise is another commonly asked question, and I would say that you can do walking and brisk walking as an exercise maybe in a week's time after surgery, but doing any heavy exercises, lifting weights, I would advise please wait for at least a month or two, because we would want internally the muscles and the sheath also to heal. If you strain too early, too soon, there are chances of developing a hernia at the port site. So be careful, go slow, and you should be fine. Thank you.